My name is Amir Kaki. I'm the medical director of the Cardiac Catheterization Laboratory here at the Detroit Medical Center Heart Hospital. And I'd like to introduce to you the world's smallest heart pump, the Impella. So the Impella pump is a small catheter that fits through a leg artery or through the arm artery, through the axillary artery or the transfemoral artery, and it goes into the ventricle, and what it does is it's a mechanical axial flow pump which takes blood from the ventricle and ejects it out into the aorta. It does several things. It decreases the pressure in the left ventricle. It decreases the oxygen requirement of the left ventricle. It increases perfusion to the coronary arteries, which supply the heart muscle. It increases cardiac output, which in turn increases the perfusion to all the vital organs, particularly the brain and the kidney, and patients who at some time may have had an acute insult and the heart was unable to function. So it will actually complement heart function to make it sustainable with life, or in some cases where the heart's not functioning at all, it could act as basically a pump perfusing the entire body, giving the patient a chance for their native heart to recover, or if not, to be able to get them alternative advanced heart failure therapies such as left ventricular assist devices, which could be permanent, or bridges to advanced therapies like heart transplantation. Here's a good example how this technology has helped patients survive.
It is a company outing at the Detroit Tigers game. I was with my parents and we were leaving the game, and we were walking to the people mover platform, and the elevators were out, so we had to take the stairs up. And as I was walking up the stairs, I started feeling that shortness of breath and that pain in my chest. And then after we got to the top of the platform, my heart gave out and I blacked out and collapsed.
That night, Dr. Elder, who's my partner, and myself happened to be on call. Zach actually had sudden cardiac death at the Tigers game where he had a heart attack and went down. He was brought over here, and again, here's Cardio Team 1 at work. We emergently took him to the catheterization lab. He had cardiogenic shock. We were able to put the Impella in his heart and found that he had all three of his major arteries blocked. So at that time, with the assistance of the Impella device, we were able to open all three arteries. We kept the Impella in for a few days and it permitted his heart to recover. And I'm proud to say today that Zach is, 3 or 4 years later, he's actually a graduate from the University of Michigan. He's highly functional and his heart has totally recovered, and he has a normal life expectancy despite having had this really profound medical event that he survived. This is groundbreaking technology. Historically, if you look at the survival rates of patients who had cardiogenic shock, is when you have a heart attack and the heart muscle severely compromised, the survival rates for those patients in randomized trials was 40%. In our first 40 patients that we did in Southeast Michigan in a collaboration with many hospitals here, using this technology, we were able to show the 1 month for survival being as high as 75%. And we're very proud of this. We're changing the paradigm for the treatment of a disease which historically for the last 2 decades has been, your chance of survival has been less than a coin toss. So this is groundbreaking. This is really revolutionizing the way that we treat patients, particularly cardiogenic shock.